All right, gentlemen. Can you guess what is that place which is shown in the picture? It's Everest. It's not looking like a very high, because the view is beautiful and it seems like a high mountain, but it is actually Everest here. And even though it's beautiful, but at the same time it's deadly also. You know that. No one can survive at that altitude, okay, if you consider the Everest. But life at high altitude is possible. Okay? How is it possible? We will discuss, and what happens when we start living at high altitude. This is our discussion. Coming back to Saudi Arabia. What is the highest point you find in Saudi Arabia, generally speaking? Al Sauda. I think most of you, if not all of you, have been to Al Sauda. Everybody has seen that. Okay? The chairlift is also there, and you go to the top of the mountain. You can come down to the village also, and that's a beautiful place. How much is the height of Al Sauda? Any idea? 3,000, approximately 3,000 meters, which makes about a little less than 10,000 feet. Okay? So it's a moderate elevation, not a very high one, a moderately elevated area, and we'll see that inshallah. Okay. The title of the lecture is Acclimatization. Acclimatization. Okay? I'm sure you know the meaning of the word climate. What is climate? Weather. Okay, then what is weather? It's climate. Okay. Yeah. Is there any difference between weather and climate? Yeah. Okay. Meaningfully, very nice. When the conditions are established for a long time, if you're studying a weather condition for a long time, then it turns into a climate. Okay. And if you are talking about a particular time, today at this time, or tomorrow at this time, or at one day at this time, is it cold or is it hot or rainy or Shams is there or whatever, then this is the weather condition. Okay. So we talk about the climates. So if atmosphere is studied on a short term basis, you call it weather, and if you are considering it over a long period of time, then you call it the climate. Okay. When you are living at a special place like an altitude or an elevation, okay, then you need to know about the climate of that area, because once you start living there, you will have some adaptations in the body or changes in the body, because that is different from the lowlands. If you go to a place like sea level, for example Jeddah in Saudi Arabia, okay, then you are a lowlander, you are living at the lowland. But if you are coming to Taif, or if you are going to Abha or Baha, or if you are going to any other place which is at high level, then definitely you will be living as a highlander. Most of you, I believe, are from Taif, and you are born here. Many of you are born here, I believe. Okay? So it means you are the natives of Taif. You are born here, living at high altitude. Your parents have been living here, your families have been living here, and you are born here, you are raised here. So it means you have all those changes present in your body which natives have who live at high altitude. Okay? Taif is not a very high altitude, you know. It's hardly 6,000 feet or 6,500 feet, 5 to 6,000 feet, not more than that. And less than 2,000 meter actually, less than 2,000 meter, if I say meter. Okay, it's not high, but it's a good place really, and there is some elevation. So definitely some changes have occurred in your bodies. Those of you who don't live in Taif, who come from Makkah or from Jeddah and stay for some time and they go back, okay, the situation will be different in those persons. But those who are living here, they will have definitely some special changes happening in the body. Okay? Well, all those changes which are happening at altitudes or high altitudes are regarded as acclimatization, when you are adjusting to the climate at a new place, when you are adapting or when you are showing changes in the body, this is known as acclimatization. Okay? So this is also known as the high altitude changes or high altitude physiology. All right. These are the objectives that we are going to do. We'll have to see what changes physiologically and biochemically and structurally occur in the body when we are living at high altitude. And are there any good effects of acclimatization or bad effects of acclimatization? We'll see that. Defining the levels of altitude, high, very high, and extreme altitude. Well, high altitude, if you say, how much should be the elevation of the high altitude? Here you can see it's about 1500 to 3500 meters. It makes about taqriban, a little less than in feet, if you say. Well, if you say the range in meters, 1500 to 3500, and if you convert that into feet, it will be up to about 11,000 or a little more, 11,500 or so feet. Okay? Now you are going very high altitude. Okay? Well, that starts from 3,500 to 5,500 meters, and that goes up to the level of 18,000 feet. All right? Above 18,000 feet, well, the situation is very, very unusual, and life is usually not possible. Usually not possible. People are living in different parts of the world up to the elevation of 18,000 feet or around that, not more than that, because then there are problems and complications there. Okay? But unusually people are living at that altitude. Extreme altitudes, you can surmount, you can go to that altitude, like the mountaineers, the team of mountaineers, they go, but they don't live there. They go, they explore, they visit, they study something, and they come back. It's not possible really to stay at that altitude because it's deadly. That altitude goes above 18,000 feet, and there is a specific zone of death which is very, very high, above 8,000 meter, above Takriban 25,000 feet or so, there is a death zone on which nobody can survive, and without oxygen it is almost impossible to go there and to pass time there. Okay? We are interested in two areas in Saudi Arabia. One we are living in, that is Taif, and the other one is Al Sauda, for comparison, which is a little more elevated when you go to Abha. Taif is not really much elevated as we see. It's around 6,000 feet or so, 6,500 feet. And Jabal Al Sauda, if you go there, it's about less than 10,000 feet. So it's elevated than Taif, definitely. So you will have more changes seen in those people who are living around Jabal Al Sauda than people who are living in Taif. Definitely more challenges will be there. Okay? These are some changes which happen, but before, in the previous slide, if you see one side of the slide, you will see that the oxygen levels are decreasing as you are going up and up. Do you see that? From a level of 100% that you consider, you keep 100% for the sea level, yani Jeddah, for example. Okay? But as you go up, your oxygen percentage decreases. In terms of percentage, it is decreasing, isn't it? And you can see here, when you go to 10,000 feet or so, the level of oxygen as compared to the sea level falls to 70%. It's 70%. It is okay. We can still manage at that level, but the level of oxygen has dropped. The air is becoming thin. Oxygen is less. The pressure of oxygen is dropping as we are going up and up. Okay? Fortunately, both areas, Taif and Al Sauda, they fall under the height of 10,000 feet. Okay? It means definitely the oxygen level in Al Sauda would be more than 70%, okay? Around 80% or so, 75-80% of oxygen is still there. And if you come to Taif, you will still have better oxygen, definitely. Maybe around 85-90% will be there in Taif. Okay? Same is the case with Al-Hada also. We are considering Taif and Al-Hada together actually. Okay. Now the changes definitely occur. Look at the percentage of oxygen and the oxygen saturation which is falling. Okay. Saturation means the hemoglobin saturation. Do you remember that? Okay. We have done the oxygen saturation. It's decreasing as you are going. Look at the different levels of oxygen saturation given on one side. Do you see that side? On your right side, you will see that. Okay. The sea level is about 99% or so. And when you go to the height of about 6,000 meters or about approximately less than 20,000 feet, well, it falls to 75%. You cannot have more than 75% saturation because oxygen is less. No problem in the hemoglobin. Hemoglobin is mawjood. But the oxygen pressure which is coming, the oxygen which is coming from outside, it is very, very low in those areas. Okay? What are the challenges which we have to face on the high altitude when we are living? Okay? Not really in Taif, I would say, don't consider yourself as a victim because Taif is mashallah good. Very little problem will be there. Okay? We are very well adjusted. We have no problem. None of us will show this problem really here. But as you go to altitudes like Al Sauda or even above, definitely you have to face the challenges if you are living there. Hypoxia is the first thing. Everybody knows about hypoxia, right? Okay. The second thing is that the temperature is dropping. You know the areas. Taif is okay. Taif is okay. In winter it becomes a little barid. In summers now it is becoming hot really. It's no more a moderate weather. It's changing. Everything is changing. When I came here 10 years back, it was very different really 10 years back. And now things are changing. Global warming is happening. But generally speaking, when you go at altitude, you will see that the temperature is moderately low. It's a good temperature. Okay? It's pleasantly cold. In this region or even in Abha and Baha, it's pleasantly cold really. Okay? So there is a drop. As you go 1,000 meter elevation, definitely there is a measure and there is a drop of the temperature. Okay? So the temperature is falling. The third factor is aridity. Anybody knows the meaning of the word aridity? Then there is one more problem we have faced in the atmosphere of Taif, in the climate of Taif, with the jild. What problems happen with jild? Dry? Yeah. Usually we have a dry skin, isn't it? It's not really very moist. If you go in Jeddah, your skin is soft and a little moist really. Okay? But here when you are there, you see the skin usually gets dry because of the dry air. So it's the dryness in the climate which is there, and that dryness is not affecting your jild. That dryness also affects your systems, your mucous membranes and your respiratory system from inside, isn't it? Wherever air can go or air is in contact, that will be affected by the dryness. So aridity is dryness which is happening. Okay? And the fourth thing is, because you are going up, the radiation of the Shams, now you are going close to Shams, isn't it? As compared to the sea level. Okay? Don't compare the total effect of heat, that Jeddah is hot, so Shams effect is more there. I am talking about the radiation or the waves which are coming. The waves are coming more really, and at altitude the ultraviolet rays, their exposure, their danger increases as compared to the sea levels. Okay? So we have got some challenges or stressors which are there coming to our body: hypoxia, cold, aridity and radiation. Okay? Alright. We are using different terms. One term is adaptation. Adaptation means adjustment. Okay? When you are adjusting to something, you are showing adaptation. Okay? Likewise, when we are living at a high climate, high level, our body has to adjust really because of different problems. So body has the capability to make adjustments from inside, and these adjustments are generally known as adaptations. Now these adaptations can be developed in one system, or these adaptations can be multi-system, occurring in many parts of the body. It depends really on the situation. These adaptations can happen on artificial basis. If we provide a special artificial atmosphere to a person in one room, if we keep a person and the room is very cold, barid really, all the time, and the air is also dry and the oxygen is also low, it means you are creating an artificial atmosphere of the high altitude here, okay? The same thing. If you are making it artificially and then you are studying something, you call it acclimation. It's known as acclimation for the artificial setup. But if you are naturally moving to a high altitude, you are going to live at a high land, then the automatic changes, the natural changes which are occurring in the body, which are happening in the body, these changes are called acclimatization. So we are differentiating between the two terms, acclimation and acclimatization. Both are changes. One is an artificial set of changes and one is real changes in response to the atmospheric conditions, okay? All right. Acclimatization, please. This is our target. To survive at high altitude, the body has to make changes not in one system but in many systems, so that you maintain homeostasis inside the body and everything goes all right at the cellular level, tissue level and organ system level. Everything is fine, okay? Now this acclimatization is different at different altitudes. If you are in Taif, you need a very little acclimatization really, because it is not very high. If you go to Al Sauda or at a higher place, you need a little more acclimatization in your body. If you are living at a high altitude more than 10,000, yani 15,000 or so, for example, in that case, what will happen? Your acclimatization will further increase, the challenges will further increase. So there are darajat of acclimatization according to what level are you at. This is very important. So one is the level, okay? Second is, how is hypoxia coming to your body? Is it coming acutely or chronically? For example, I am going to a high altitude of 15,000 feet and I decide that okay, in 5-6 hours or 7 hours I'll quickly go by the car on the mountain, and I go there in just 5 hours or 6 hours, okay? Well, that will be an acute change coming in my body, because I am traveling from Jeddah and I am going to a very high place within like 5-6 hours very quickly. Then acute changes, the acute hypoxia will be there. If I am going gradually, that I am moving from one place and I go to about 1500 feet or 2000 feet and then I stay for 1 day there or 2 days there, and after 2 days then I go to another level and live for 2 days, and then again a little height, and then 2 days and 3 days. So in many days I reach the height. Now the changes will be different really, because I'm staying at different altitudes and I'm not exposed to the acute effect of the hypoxia, okay? Then of course, as a person, according to my physiology, okay, everybody of us are different really. So the body response is a built-in response. How will I react to hypoxia? Some persons, when they go to high altitude, they have no problem, okay? They can go to a very high altitude and they are so strong and their body is so compensating that nothing really happens. And some persons, when they go to the high altitude, all of a sudden they develop a kind of breathlessness or a headache or uneasy feeling or kind of drowsiness like this. Yani, the response is different, okay? So individual response is also important. Okay? Our genetic makeup, our body makeup also decides about what will happen when we go to the high altitude. So it's a combination of different factors. It's not one thing, please. Okay? It's number one, how much altitude? Number two, What type of hypoxia are you exposed to, and what is your body response? These are the factors we are looking at. Okay. We'll divide the changes of the acclimatization into three parts. Immediate changes, which are happening very quickly over hours within a day, and some changes which are occurring as intermediate changes, and finally when you are staying for weeks to months at the high altitude, the chronic changes will start. Okay? Look at the immediate changes, Shabab. Please have a look at the immediate changes. Well, when we are going very quickly to a high altitude, our different systems show a reaction or a response. They have to bring changes in order to maintain oxygenation, in order to maintain the metabolism of the body. Okay? One by one, let's have a look at the systems, please. Lung. Because you are doing respiration, you will find an ease to understand what changes are happening in the lungs. You can see it very easily. The first thing, you can very well expect that your tanaffus, your rate of respiration will change, and it has to increase, isn't it? The second thing which can happen is your tidal volume also increases, yani your depth of respiration, breathing also changes. Okay? Inside your lungs, when you are going and your lungs are facing hypoxia, your blood vessels of the lung will respond to the hypoxia very quickly, immediate reaction. And do you remember, lungs are very special and very different as compared to the other parts of the body. They don't really dilate their vessels in response to hypoxia. It is an opposite reaction happening. Vasoconstriction, just to save the blood flow in unnecessary areas and switching the blood flow in other areas. So if you are exposed to hypoxia, your response of pulmonary system is vasoconstriction, isn't it? Do you agree with me? It's vasoconstriction. So it's pulmonary vasoconstriction. And if there is pulmonary vasoconstriction generally in the system, then what will happen? The ventilation perfusion ratio will try to match really, because your ventilation has low oxygen coming, isn't it? And your perfusion was more. Now you have to make adjustments in order to maintain a match between ventilation and perfusion. You will have pulmonary vasoconstriction. That will happen. Okay? Well, pulmonary vasoconstriction means it's pulmonary hypertension. You are going towards pulmonary hypertension. If it stays for days, then pulmonary hypertension will develop at that time. Okay. Cardiovascular system, Shabab, CVS. What changes happen in the cardiovascular system? You need to supply more oxygen to the tissues, all the tissues. Your heart has to work more. So, generally speaking, yeah, tachycardia, output both increases. Tachycardia, force of contraction, output definitely increases. Cardiac output is yes. Okay. The blood pressure also tends to increase because of the venous tone, and the cardiac output is increasing. There is slight elevation of the blood pressure to maintain a better blood flow. Okay. The DO2 increases. What is DO2? DO2 is a new term for us. We have never discussed this word DO2 before. We talked about the PO2, PCO2 like this, okay? But we never talked about the DO2. Well, it's very simple. If you see cardiac output multiplied by the oxygen content of the blood, okay? It means you're talking about the delivery of the oxygen. D means delivery or the supply of the oxygen to the tissues. So DO2 means the delivery of oxygen to the tissues. So delivery definitely increases because your tissues definitely have to be supplied with oxygenation because hypoxia is developing and something has to be done. About the brain, what kind of changes will happen in brain, please? Okay. The cerebral blood flow will change. There is an increased flow of the cerebral blood, and the idea is to supply more oxygen. Your brain depends on oxygen primarily. So oxygen has to be supplied. The best way on acute basis is to dilate the vessel, so more blood will flow. If the blood flow all of a sudden increases, cerebral blood flow increases too much in the brain, what can happen possibly? Headache. This is a very common problem happening at the high altitude if a person goes very quickly up. Some of us develop a kind of headache that we are feeling heavy-headed. That's because of cerebral vasodilation. Not all of us, I'm not saying not all of us, but some of us. What can be the second problem if the blood flow remains high thereafter? Cerebral congestion, and that congestion means what? The vessels are congested, full of blood, more blood is going, thank you very much, but what will be the consequence of that congestion? No. Something will happen in the brain tissue, and what is that? Edema. There are chances of edema, cerebral edema can develop. So one of the complications of that cerebral vasodilation, which can happen in some persons, is edema, chances of cerebral edema. Okay. The GIT also shows some changes in the form of decreased appetite and slowing down of the activity of the GIT, some slowing down of digestion and changes in the appetite are also observed. Well, these changes are occurring probably in response to the centers which are controlling the GIT. Okay? Shabab, the previous slide was about the immediate changes which are occurring quickly. Okay? Intermediate changes over few days. Now, when you are going at high altitude, please, what is happening to your rate of breathing? If you are breathing more, what is happening to your overall ventilation? It is increasing. If you are having more ventilation, what will happen to the level of carbon dioxide in the blood? Decrease. So what will happen to the pH? Alkalosis. It means you are moving towards alkalosis. Do you agree? And is that respiratory or metabolic? It is happening because of your, so it's very simple. It is respiratory acidosis, alkalosis. Okay, so you are going towards respiratory alkalosis. Now, respiratory alkalosis is not really needed by the body. It has happened in the body, but the body does not require that. Okay, so body will try to bring it back to normal. Now, you can't do it with the help of ventilation, because ventilation is producing respiratory alkalosis. You need some other system to work in order to remove the effect of the respiratory alkalosis, and your helpers, excellent helpers, are the kidneys. Okay, now kidneys will try to decrease the effect of alkalosis by removing the bicarbonate ions. So there will be excretion of the bicarbonate ions. Okay, so respiration is producing alkalosis, kidneys are compensating the alkalosis. All right. Okay, so compensation comes from the kidney. All right. Diuresis, there will be a little effect, and you will have alkaline diuresis, in which bicarbonate ions are excreted in the urine. Okay. Intermediate changes in the pulmonary system, in the lungs, please. What changes are happening? Adjustment of the ventilation perfusion ratio, that will happen. And I told you in the beginning that if you are maintaining it and there is vasoconstriction for a long time, then it will turn into pulmonary hypertension. So now we are using the term pulmonary hypertension for this purpose. Okay. Who remembers the word 2,3-DPG, and where is it? It's in the RBCs. It is a special metabolite which is formed in the RBCs from glycolysis. It's a byproduct of glycolysis, but it is helpful. It is good. 2,3-DPG is a very powerful agent which tends to dissociate oxygen from the hemoglobin. Remember, and it is good for the delivery of the oxygen at the tissue level. Okay, so if you are at high altitude and you want to give more oxygen to the tissues, do you want more DPG or less DPG? The 2,3 DPG, definitely. So there is a shift towards increased levels of 2,3 DPG. It means living at high altitude will increase the amount of 2,3 DPG in the RBCs generally, and this is good. Okay, it changes, it's shift. Okay, now considering weeks and weeks and months you are living, okay, more than few weeks you are living and you have to stay for a long time, for example 2 months or 6 months or 1 year or more at high altitude. Now the changes which are happening in the body are known as the long-term changes, please, okay, over a period of time. Now you will see some very good responses, really. Okay, hematological changes in the blood. What do you expect in the blood, Shabab? Definitely hemoglobin has to increase, because hypoxia is there, your hemoglobin is not enough, you are living at high altitude for a long time, your body has to increase hemoglobin. So hemoglobin increase should come from the bone marrow, yani from production. For production you need stimulation, and for stimulation you need a hormone that's a supporter that will stimulate the bone marrow. So it's very logical. Okay, RBC mass will definitely increase, and at the same time you will see some changes, very special changes occurring in the cardiovascular system. Okay, gentlemen, we have capillaries, and all the time in our body at rest, capillaries, all the capillaries are not working. Okay, in a tissue maybe 25% capillaries, 30% capillaries, 40% capillaries are working at a time, and the remaining capillaries are standby, they are waiting. Whenever there is need for extra blood flow, they will open and the blood flow will go, no problem. So they are mawjood, but not all are working. When there is hypoxia, the first thing which happens is that your all capillaries become functional and they start working. Okay, but when you are living at a high altitude for a long time, even all the capillaries which are present, they will not be sufficient, because your capillary design, your capillary number, I am asking about a person who is living at low level or the sea level. Okay, he has a specific number of the capillaries, and that capillaries are built for a person to live at the sea level. Okay, when he exercises or when the blood flow increases, demand is increased, all the capillaries will open. When at rest, less capillaries are there. But if that person moves to a high altitude, his all capillaries will be working at any given time in response to hypoxia. But maybe those capillaries are not sufficient. Still you need more capillaries. Now your all capillaries are working and you need more capillaries. Now the body will do the restructuring. The cardiovascular system will design new capillaries. This is called the angiogenesis or neovascularization. New vessels are formed and the capillaries will be structured. Capillaries to meta-arterioles, meta-arterioles to maybe arterioles, it depends on the needs actually, but the capillaries and the meta-arterioles, they increase in number. So it means in the vascular system you will have the functional change, yes or no? And you will also have the structural change in the cardiovascular system, yes or no? Yes. Oh yeah, both changes are there. Okay, the skeletal muscles contain a high level of the myoglobin. The myoglobin is a hemoglobin like pigment to hold oxygen. It is present in the skeletal muscles. It will also increase. Okay, mitochondria, well here the word decreased number is written. Okay, there is a question mark, don't take it as decreased. Well, the number of mitochondria either remains same, okay, we'll change this word, okay, or the number of mitochondria increase in some situations. Okay, in response to hypoxia there are variable situations. In some situations the mitochondria number remains same and their function increases. In other situations their number is increased and their function is also maximum. According to the need of the situation, it changes really, okay? And in some of the responses, in some of the studies, it has been shown that there is a decreased number, but by and large, if you are considering, the mitochondrial response increases, okay? Take it, generally. All right. When you are living at a high altitude for a long time, look at your cardiovascular system and look at your heart. What changes are there? Gradually, heart rate, okay, changes slightly. If it was high at the initial time acutely, then it will slightly drop, but it will remain high, okay? It is not coming back to normal, exactly normal. For example, from 70, if it went to like about 100, then after living for a long time, it may come to a value of like 90 or 95. It is dropping, but still it is higher than your resting rate when you were living at the sea level, isn't it? So it's changing. Well, the cardiac output is kind of adjusted, okay, because of the multiple changes happening in the cardiovascular system. The cardiac output tends to become almost close to normal, and the blood pressure is also coming down back to normal. But this is happening when you are living at a high altitude for a long time, okay? That is the same response through the baroreceptors, so through the carotid body and the chemoreceptors. What changes are happening? We are just thinking about how our respiration is stimulated. It's the same mechanism. We have the carotid and aortic chemoreceptors, which are sensitive to hypoxia and the carbon dioxide levels, okay? So these changes are happening because of these receptors, okay? The changes, when we have alkalosis developing in the body, then these changes are affecting different systems. The response of the carotid bodies and aortic bodies, they change, and there are changes coming in the cerebrospinal fluid also, okay, to change the sensitivity of the respiratory center, okay? Your Merkers is changing and your peripheral chemoreceptors both are changing, and their sensitivity is changing in response to alkalosis which is developing. So first there is hypoxia. After hypoxia there is alkalosis which is developing, and then after alkalosis there is a change coming in your respiratory system. The sensitivity is changing. Peripheral chemoreceptors and the central respiratory center both are changing actually. Look at the changes. Total lung capacity, living for a long time, okay? The shape of the chest changes and it becomes like a barrel-shaped chest, okay? The shape of the chest is changing because the capacity of the lungs is changing over a long period of time. So if you look at the Highlanders who are living there, who are born there, not you, I'm talking about those who are living at more than like 12,000 or 15,000 feet, and for a long time their chest becomes kind of a barrel shaped or a rounded shaped chest, okay? Anteroposterior diameter increases and overall their lung capacity is increased because it's a compensatory response. Structural and functional changes happen in the lungs, okay, and in the thoracic cage as well. Taif, yeah. Yeah?
I mean, how it this change because
Yeah.
the person can push muscles and ribs.
See, the barrel-shaped chest can occur due to multiple reasons, okay, in different diseases or in different physiologic conditions, okay. If the lung size is increasing, okay, gradually over years and years, and there is more trapping of the air inside the lungs, then generally there are changes in the pleural pressures and due to those changes, okay, your chest wall is also affected, and overall the shape of your thoracic cavity will change. One thing is the size which is there, accommodating the size, and the second change which is coming in the thoracic cavity elasticity. So overall, with the time, with the passage of time at high altitude, the lung size is increasing, and the pressures inside the pleura and the lungs, they are changing because you are managing at high altitude, and that affects your thoracic cavity recoil also to some extent. So overall size of the chest, which was like this, it becomes a little globular in shape or a little rounded in shape, barrel shaped chest. Okay, there is no pathology happening inside. It's not the pathology condition. It's not like emphysema. No, it's different here. Okay, it's only more trapping of the air and changes in the structure of the lung to accommodate more and more. The elasticity of the lung changes, and at the same time the pressures are changed inside the thoracic system, and those will account for some changes in the rib cage also, elasticity of the rib cage. So overall slight change in the chest shape. Accessory muscles are also developed in those persons. Okay, those muscles are more active, accessory muscles, and those muscles also have some pull. So the shape of change is also affected by the accessory muscles which are trying to elevate the ribs. Okay, so multiple factors are working together to change the shape at high altitude. Okay, physiological polycythemia. Okay, we have talked about that. Erythropoietin has to increase. The amount of hemoglobin, it increases, Shabab. We will do it inshallah in the tutorial also. We'll see that in how many days what happens if you are living at high altitude for 1 month or 2 months. What kind of changes are you expecting in your hemoglobin concentration? We'll talk about that. But generally speaking, the amount of hemoglobin increases, and maybe if you are living for a long time, up to 50% more hemoglobin we can gather. We can increase the level of hemoglobin up to 50% more, okay, at maximum. So if the level of my hemoglobin was 15 or 14, for example, okay, living at the sea land, and when I go to a very high area and start living there for many years and I develop a maximum response, maybe my hemoglobin can go above 20 or up to 20. Okay, it can become 20 or 20 plus really in that case. So it is touching a value of about 50% or so in extreme conditions. Okay, all right. One more thing, we talked about the word excretion of the bicarbonate ions from the kidney, and I used the word diuresis at that time, diuresis. Okay, we are talking about alkaline diuresis, alkaline diuresis. Alkaline because bicarbonate ions, and diuresis because some extra urine is produced. Now the question is, why do we have extra urine? Any idea?
No, but let's say it's
Okay.
so there will be osmosis when urine.
Yeah. Now it's very interesting. The volume of the blood. Shabab, the volume of the blood, please. There is a shift because in the lungs you have vasoconstriction. Your size of your pulmonary vascular system is becoming smaller, isn't it? So the blood has to be shifted to the systemic circulation or the central circulation, isn't it? So your central circulation will expand a little. Okay, there is expansion of the central circulation. If there is expansion of the central circulation, then there are some hormonal changes happening, and one of the hormonal changes you can see is that your system is already loaded with extra volume. Two hormones will decrease, ADH and aldosterone. both these hormones are trying to manage the volume, okay, of the blood. If the volume is increasing, these hormones will decrease. If the volume is decreasing, these hormones will increase. In this case, your volume is increasing. So these hormones are decreased because there is no need to have these hormones in high quantities. If these hormones decrease from their normal values, what will happen? ADH is working on the kidney, okay, and aldosterone is working on the kidney for the water reabsorption. If these hormones are less and they don't reabsorb water from the kidney, what will happen to the urine formation? Increased, okay. So urine volume increases, and that's why we call it diuresis, okay. So a shift from pulmonary circulation to systemic circulation, increase in the volume of your systemic circulation. This will affect the hormones. Which hormones? ADH, and that will affect the kidney reabsorption of the water. So more water is passing along with the ions. It is diuresis, okay. All right. Cardiovascular system, please, very briefly about the cardiovascular system. Okay. Well, definitely as we go on the altitude, the heart rate and the sympathetic tone changes. We have high blood pressure in the beginning, heart rate increases. Later the blood pressure becomes taqriban normal and the cardiac output also falls, but the heart rate remains a little high. We talked about that, okay. Vasoconstriction will be there, but it will stay in the pulmonary circulation. Do you remember that? Pulmonary hypertension can develop. The structural changes will come in the tissues, new capillaries, new microvessels. The microvessels will increase, new capillaries will form, okay. If you are coming to the systemic tissues, our muscles and other tissues which need more blood flow, what do you think the response will be? Vasodilation or vasoconstriction in our systemic areas like muscle especially? So the systemic areas are maintained at slight vasodilation because it is good for that, and your lung circulation is maintained at slight vasoconstriction because it is required by the lungs at that time, okay, for a match. So this is the situation, all right. So this situation balances the cardiovascular system activity and everything is maintained at the optimum level. Now inside the cells, not talking about the systems, respiration or the kidney or the GIT or the brain or the CVS, no, we are talking about the inside of the cell, yani metabolism. What changes? Generally we expect that mitochondria will show they are more needed actually, isn't it? Because if less oxygen is coming, then you have to utilize the maximum of the oxygen and you have to increase the machinery inside the cell to make the use of oxygen which is coming. The mitochondrial density increases. The mitochondria have a dense matrix inside, and this matrix is filled with the enzymes. So the matrix and the enzyme quantity will increase. Enzymes will increase inside the mitochondria, the size of the mitochondria changes, and in cases the number of the mitochondria is also increased, as we discussed earlier, if you remember, okay. So the enzymes are increasing. One more thing in the cells, especially we are talking about the muscle cells, the skeletal muscles, myoglobin, which stores oxygen or holds the oxygen. What should happen to the myoglobin? Okay, it will. All right. In some persons, okay, there is a very special type of breathing which happens at high altitude, and this breathing is called Chin-Stokes breathing or the periodic breathing, okay. Now this breathing has a typical pattern. First of all, it's a shallow breathing, and then it becomes deeper and deeper, and then again it ceases, it stops, and then again it starts, okay. It is shallow and then it becomes deep, and then again it restarts after cessation. The breathing is increasing, okay? It's shallow. During the sleep, the person has a typical pattern. The person is sleeping. And then there is a pause for a few seconds, 1 or 2 seconds, and then again after a pause. So you'll see gradually from shallow to deep the breathing is changing and increasing, and it increases till a pause, and then after a pause again a pattern of shallow breathing starts, and then it is deepening, and then it is deepening, and then it's stopping. So these cycles are seen in some of the persons. This is called the periodic breathing. This happens sometimes at high altitude, and sometimes this breathing is seen in some pathologies when there is damage to the respiratory center. Okay, in some cases of pathologies of respiratory center damage, this kind of breathing is seen. And once the person is having apnea during the sleeping, the person wakes up from that. So the sleep is disrupted or it is disturbed at that time. Okay? And this gives a very bad sleep to the climbers or the persons who go there, and usually they don't have a very sound sleep or a good sleep because of this kind of a pattern. Okay? This happens. Alright. Summary I am leaving it to you, because that summary is what you have already done. What will happen to alveolar PO2, PCO2? Please do one thing. Cover the right side of the picture and see how much do you know about yourself. Alveolar PO2, what should happen to the alveolar PO2? Increase or decrease or same? What will happen to arterial PO2? What will happen to hemoglobin concentration? It's very easy. You have to say yes or no simply. Okay, so just test yourself. How much do you know about that? It was very simple. Okay, now response to acclimatization, we are just finishing it up. Some features happen. There is a sense of fatigue at high altitude, please. Okay, there is mild shortness of breath. SOB means shortness of breath. SOB, shortness of breath, and the person becomes subjectively aware of breathing very quickly. All right. All of the changes we have discussed really, except the weight loss. Weight loss is also seen when the person has diuresis. Okay? If I'm having diuresis, extra fluid is going from my body, which was the part of my circulation. What will happen to my wazan totally? Okay? Slight change in the weight or slight weight loss is there because we are losing extra fluids from the body. It is not giving you any problem or dehydration, but generally speaking, the weight of the person decreases to some extent, slightly, very little, not much really, nothing significant, but there is weight loss. And living for a long time, then you will have a compensation also, but this change is also observed. So Shabab, changes in different systems, changes in your sleep pattern, changes in the feelings also, a sense of fatigue and shortness of breath. These are the subjective feelings that you have. Important thing, please. May I have you all? At the back also, please. May I have your attention? Please. We are just finishing it up. Look at the slide. Now the performance, the muscular performance or the physical performance at high altitude, okay, or the other types of performances of our body. The first thing, the first performance which is affected is the physical performance when we are above 4,000 feet. There is a slight change in the physical performance. You might wonder, you are living above 4,000 feet and you may have a little change. That change is very, very little in Taif, because Taif is not really very much elevated. But the physical performance as compared to a physical performance in Jeddah or living at sea level will be slightly different. The person who is trained in Jeddah or the person who is living in Jeddah will have a slightly better physical performance as compared to you, slightly different, because you are still living at an altitude. So there will be a slight difference in the performance, not very much, but physically, yes. Cognitive performance, your mental working, your thinking ability, that is affected at 8,000 feet. So safely speaking, there is no problem at this altitude. The thinking ability is not affected, but physical ability is slightly affected. Okay? After some time, there is adjustment to it also, but there is an effect. Your judgment ability to make judgment and analysis, analytical ability and judgment ability, okay, that requires higher level of cognition. And that is affected, that you are unable to make decisions and to make judgments, proper judgments. That is affected usually at 10,000 feet and above. Okay? So at different levels, you have different activities or performances which are changing. Physical performance after 4,000 is affected. Mental performance, thinking performance after 8,000, and your judgment, critical decision abilities or judgment abilities, analysis, 10,000 or more. Okay, yeah.
What's mean cognitive performance?
Cognitive means your thinking process. Okay, when you are thinking, you are listening to me, you are understanding my language, you are reading, you are understanding, you are working, and your mind is thinking. Okay, general thinking. This is affected after 8,000, and your decision making, your judgment, your analysis, which is the higher level of your thinking, that is affected at 10,000 feet or above 10,000 feet. Okay, so cognition means your mental working, thinking. All right, physical performance, Shabab. The physical performance definitely is affected in terms of percentage. Please see, there is 1% loss for every 100 meter above 15,000 meter. When you go above 15,000 meter, there is no problem up to 15,000 meter. But after that, when you go, for every 100 meter, there is a slight fall in your physical performance. 100 meter above, your physical performance will change 1% taqriban. So at the level of 2,500 feet, for example here, your physical performance comes down to 90% of your total, okay, at sea level. And if you are living at 8,000 meters, which is about 26,000 feet, well, your physical performance has fallen really to 65%. Okay, it's a big fall really. It's not easy. It's very difficult really. This is a graph of the performance. Look at this graph and study this. Try to understand the graph. What happens at the arrival? After some time, what happens when there is acclimatization? And once acclimatization is complete, what happens, okay, to your fitness levels? I am leaving this graph for you, for your comparative and analytical study. You will compare the graph number 1 with number 2 with number 3, and number 3 with number 4. The stages, how things are changing when you are giving an opportunity for a person to live at high altitude. Arrival at that time, then after arrival what happens, then when person lives for some time, what happens to that activity, your fitness level, and then is your fitness level same like before when you came, or is there any improvement or change in that one? Please, yeah, definitely you will see the changes, but you will have to compare really from the beginning to the end. Okay, the last one, acclimatization. Benefit for acclimatization. If you are living at high altitude and all these changes are happening in the body, is there any good point about the changes? Please look at this slide and see what kind of benefits do you get from acclimatization at high altitude. For example, if a person is going at high altitude and he is not acclimatizing, okay, it's not adjusting to the weather, what will be the difference between that person who is unacclimatized and the person who is very well acclimatized after living for a long time? Will there be a difference in these two persons? Definitely. Whenever these perform the activities, physical or the mental activities, there will be problems and there will be differences. A person who is very well acclimatized will have a much better physical performance, because after acclimatization the performance improves. Okay, I'm not comparing that performance with the person who is living at sea level, but I am just comparing two persons. I have just arrived today in Al Sauda and I am living in Al Sauda, okay, or above that, and you have been living in Al Sauda for 1 year or 2 years, and we are playing a match or football. After some time you will see that I'll leave that really, okay, and you will keep on doing it for a long time because your physical endurance is much better. Your body is acclimatized for a long time at that high altitude, so your enzyme systems, your structure, your muscles, your capability, working of your body, everything has changed really, okay. So acclimatization is helping the person, okay, in terms of physical performance and mental performance, okay. This is the net result of acclimatization. That's why we are having a very good adaptation naturally occurring inside the body when we are living. This is the quality of the human body. Not human body, organisms, different living creatures, they acclimatize very well, okay. So please, with this message we are finishing the discussion, and so far we talked about the physiology. One thing only which we will continue in our tutorial exercise, but look at that, if you are going to altitude and if you quickly go to the altitude, there will be some complications. One of those complications that we discussed, what was that? Headache and